Yeah, and we've again mentioned this before. I wonder if we might see more of these situations because of the state the NHS is in at the moment, because we're getting a wider variety of people coming to us with different problems.
And more telephone consultations happening now, which at times are appropriate and probably more appropriate than a face-to-face. But I always think with MSK, particularly this kind of thing, one of the biggest indicators to me is when I see a patient walk in. When I've come across patients with metastatic spinal disease, the first indicator to me that they have it is the way they move and the facial expressions and the body language. That raises my index straight away when I see certain characteristics and features of a patient's behaviour.
Yes. How then would you distinguish them from somebody who simply has chronic pain from an MSK source?
So people who have spinal fractures, whether they're pathological fractures or osteoporotic insufficiency fractures, they are in a lot of pain when they try and move, and going from laying to sitting, as soon as they load bear through the spine, it's incredibly painful, and they literally put their hands down. They can't take their weight through their buttocks when they go from a lying position to a sitting position. They can't roll over. There's a nature and a quality to their pain, and when you've seen it, you'd never forget it, and when you see it again, you instantly recognise it, and you don't get that in a telephone consultation.
This is a terrible thing. It's really helpful to have seen it, isn't it?
Yes.
And many of us, I don't know that I've ever seen that. So.
Yeah, but once you have seen it, you'll recognise it when you see it again.